So my tips and tricks for the best use of Ultherapy is to get a good assessment. So I put 10 tips all together. First of all, understand your device. Ulthera is not only a lifting machine, it is a machine that you can use for the whole neocollagenesis only portfolio. So that means that sometimes for some patients you can use for preventive treatment, young patients, and also for cases like acne scars and other things that you only want neocollagenesis and not lifting. Second, you have to assess patient expectations and the vectors of aging to understand their needs according to what they want to achieve. Second, you have to decide the depth of your transducer according to the anatomy. Not every patient has the same depth of SMAS along the different areas of the body and face. Third, you have to select the number of lines towards your goal. So if you want lifting, you have to use much more lines than if only you want just neocollagenesis of skin tightening or skin glow or preventive treatment. You have to plan your treatment. So plan the combination if you need. According to patient expectations, sometimes you also need to combine other procedures. So plan beforehand. Tell the patient that in order to achieve what they want, you need to combine other treatments with Ulthera, or you need to do more than one treatment with Ulthera. So plan beforehand. Treat the patient accordingly. So get good pictures before and after in the same angle or with the 3D devices pictures in order for the patient to appreciate the pre and the post. Use safety planning. So plan according to the anatomy and the safe areas to do the Ultherapy treatment. Also, spend time understanding the pain level of your patient. If it is a sensitive patient or not. There are many publications on different uses for different things for pain control. In Brazil, normally they're very resistant. I always use only topical cream and for 40 minutes, and then if the patient is very sensitive, I would use only ketocorolac, 10 milligrams, 10 minutes before the procedure, or 600 grams of ibuprofen. Another thing that's very important is the callback. For expensive procedures and for the sake of retaining the patient, callback is very important. So for my Ulthera patient, I use callback in a month, 3 and 6 months. I have them back in the office and I offer them some skin treatment, skin hydration, LED treatment, whatever, to as a gift. If they come back, I see them, I take a picture, I discuss with them other possible procedures. And 10th, last tip is to do not split the treatment, because it's not, for your own profit is not good, and for the cost of the patient is not good. We are advising our patients according to their budget. So do not split the Ulthera treatment in one zone, because the patient do not want to pay that amount of money, because you will lack efficacy and the patient will apparently look like he's spending less money, but in total he will be spending more money by doing 3 times the same small procedure than by doing one whole procedure at once. So be a good advisor.